what are called transverse planes. So these are connective tissue lines that are transverse, as the name implies, through the system rather than going longitudinally like most of the fascia in the system does. So I have one of those little collapsible marathon frisbees, you know, the kinds of things they give away that I'm going to use to demo, right? So if you imagine by gently holding or compressing, whether it's a joint or some part of the body, if you think of lymphatic drainage, for example, what you're doing is you're creating almost like a puckering in the system. As you squeeze, it creates laxity through that fascial plane to allow nerve conduction, blood flow, and fluid flow to occur across this area, which will help with things like swelling post-injury, as well as helping with muscles that cross joints, right? So you think of, for example, someone having a lot of tension in their neck or a whiplash injury or something, holding and compressing through this region. As it softens or releases, there may be some shear or rotation with it that takes sternocleidomastoid or some of those other muscles along with it and creates this much deeper three-dimensional effect into the jaw, into the chest, into the quality of breathing. So where would you like me to do our transverse plane demo? Maybe on the diaphragm? All right, fantastic. So we'll do the diaphragm. So what you want for this is basically to go above and below the region that you're treating. I was mentioning every joint and then 4 major areas in the body. Those 4 major areas in the skeleton are the cranial base, the thoracic outlet, the respiratory diaphragm, and the pelvic diaphragm. So we're going to be working through here. And I'm going to have one hand directly under her back at around where the diaphragm would be attaching into the vertebrae behind. And the other hand is going to be on the rib cage with my hand sort of half on the soft part of the abdomen into the solar plexus and half on the rib cage. And now the best way to describe this in terms of pressures is as you're sinking into the depth barrier, it's like you're trying to match the hydrostatic pressure of the body pressing against you. So if you try this on your own arm, for example, if you try to really squeeze your arm, it feels like you're restricting blood flow or fluid flow. It feels like you're working against your body. If you barely touch, you're doing more energy work or subtle energy type work. It can be effective and helpful. It might help with pain, that sort of thing, but you're not really engaging the fascial system. It's too light. If you can find that sweet spot where the amount of pressure you're applying feels like the body's applying the same amount of pressure back, that is where we want to be. So there isn't as much to see, you know, when you're watching at home while someone's doing this, but if you soften your focus a little bit and look at Nelin's body as a whole, we're going to see if we notice any shifts or changes. So as we've started, her breathing has deepened a little bit. You see her chest rising and falling a little bit more deeply. There's been a few little fasciculations of the eyes as there's a little bit of fluttering. Nelin doesn't seem to be as cold or anxious as I'm doing this because her body is softened into the table a little bit. Her pelvis has dropped down a little. And like I mentioned, the key to feeling is healing, right? So as Nelin is experiencing this, she's closing her eyes so she can concentrate on the sensations. I'll often coach patients to simply scan their body, notice what you feel. Imagine your awareness like a spotlight. You move it around and just ask yourself, what feels easy? What feels hard? Is there any restriction or bracing or tension anywhere? Is there anywhere I don't feel anything at all, almost like I'm disconnected? And as you notice little things, whatever those happen to be, you're going to soften into those areas. Gooey pizza cheese, butter melting, taffy stretching. So as I've been holding, there's a little bit of a rotation occurring here. My top hand is shearing towards me a little bit. My bottom hand is doing a little bit of a shearing towards the camera. Nelin's head's moved a little bit off center. Movements in the eyes are getting a little bit larger. Breathing's a little deeper, belly's rising and falling a little bit more. So what you're seeing as she gently shifts and moves is the mind moving the body for you. Our techniques are great, and all the training in the world will make you fantastic at being able to engage a human body effectively, but at the end of the day, the body knows what the body needs. So now my bottom hand is sheared towards me. There's been a little bit of a kind of a back and forth in my top hand a bit as Nelin's assuming a different position. But this is basically what unwinding can look like on the table, right? But a lot of patients believe that they're supposed to be good patients and sit there and do nothing, or heaven forbid you start to shift or roll, therapists might think you're weird, right? So we want to encourage our patients the opportunity to be able to move.